Hi, I'm Hassan. I'm a cardiology registrar working in Northumbria hospitals, and last year I was working as a teaching fellow in James Cook University hospitals. Cardiology is a specialty that I've been interested in since the start of my career, I suppose. I thought about it a little bit in med school and had some inspiring teachers, and becoming a doctor was one of my first jobs as well. And I remember being a complete novice, being quite nervous about it, not knowing what I didn't know, and gradually getting more and more experience and knowledge. And I had some really good role models in cardiology, people who had expertise and skill that I wanted. And I saw it as something that I could achieve with some hard work and some perseverance. And now here I am. Choosing a specialty is not as easy as people might imagine. I wasn't harbouring any romantic notions of falling in love with a specialty, which you might laugh as you hear that, but quite often people do. And I see people even now who are a few years into medical careers and they just haven't found anything that clicks in that way. And I think there's a problem with expectations there. I think the more boring reality of medical careers is you have an idea, there's something that you like, that you think you like. Oftentimes we don't know much about the things that we think we're interested in, but that little bit of interest is enough, and then you pursue it, you see it through some highs and lows, and I really do think it takes quite a bit of persistence. You need to have done a job for a fair period of time before you can say it's for you. Specifically to cardiology, what I like about it is that there are lots of patients with conditions that we can sometimes cure, often help with. It is very, very, very common in terms of, in other words, cardiac presenting complaints are very common, and there's so much that we can do. In terms of specialties, I think cardiology is probably the most research-led specialty, and depending on a person's interests, you can do something in the laboratory and further the research, or you can be at the bedside, you can be in the community, you can be in the cath lab, opening somebody's blocked coronary artery at 3 a.m. if you're that way inclined. What I enjoy most about being a cardiology registrar is learning new procedures. So I came to this post as the start of my 8th year of clinical practice, and starting to learn new things like performing coronary angiograms and implanting pacemakers. It has been really interesting, it's been fun, and it has certainly been character building. This far into a person's career, you don't expect that you're going to go back to being a novice again, and it is humbling, and I think it's important to realise that you can get too comfortable and you can forget what it was like when you were starting out, and it certainly builds a degree of empathy for the more junior staff. But I also love doing something with my hands, and doing something that's going to directly affect patient care. So for example, a patient with complete heart block and we're implanting a pacemaker, that's a life-saving procedure, and it's great to be a part of something like that. The most challenging thing about my job is probably the shift work when it comes to being a cardiology registrar. I think it gets harder as you become older. I'm 31 at the moment, so that's not really an issue right now. But I do know it does become harder as you become older. It doesn't help that I am always acutely aware of how bad shift work is for you, and particularly in the current system that we're working in, where the NHS is chronically underfunded and the demand for medical attention, that is attendances to hospital, admissions to hospital, is ever increasing without an increasing supply of doctors. It's difficult to always do what I would consider to be a good job for the patients, and that can be a source of frustration, particularly on late shifts, night shifts, and that kind of thing. So opportunities in cardiology, there are so many. So I am facing several choices in the years to come. I need to decide what my subspecialty interest is going to be. For the first couple of years of specialty training in cardiology, you're training as a general cardiologist, the first 3 years I should say. Thereafter you have to commit to a subspecialty, and you need to be leading towards that within your first 3 years. So if I have an inkling that I enjoy pacemakers and implanting devices, so it's a fairly surgical based procedures, then I need to show an early commitment towards that, perhaps attend some courses towards it. And I think that's an interesting aspect of the specialty, in that you can take a couple of procedures which are really quite technical. They encompass manual dexterity, they encompass knowledge of physiology and anatomy, and it's something that you can get good at. There's a sort of craft element to the specialty, and that goes for doing interventional cardiology and PCI and structural interventions, which are becoming better and better each year with things like TAVI and neurointerventions for mitral valves. There's also new niches being carved within cardiology, and new things on the horizon as well. For example, it will soon become a possibility for cardiology consultants to subspecialize in a new section of interventional cardiology where they will be performing thrombectomies in selected stroke patients. And there's a lot of iteration and innovation to be done there. So there's a lot of opportunities, a lot of research opportunities. Cardiology is probably the most research-led specialty of them all. And if that's what you want to do, whether it's clinical research or lab-based research, you can do that. If you want to be a community cardiologist and work with patients with heart failure and work with GPs, that's an option. If you want to work in a district general hospital and contribute to the acute medical take, that's also an option. There's a lot to do in cardiology, and I believe there's a niche for everybody, and I want more people to do it.